So our first job that we're going to talk through is patient transport. So this one is a 13-week program, and this is transporting patients anywhere in the hospital. So when they're an inpatient, they might have to go get a test done, an x-ray or MRI. So someone has to take them from their room to that testing site. So we teach the students to do that process. Or like if you're in the ER and you get admitted, a transporter would come get you and take you to your hospital room. So patient transport, this one is definitely more interaction with the patient because you are introducing yourself to them as you go in the room. You're getting them ready for the transport. So you are adjusting the oxygen tubing and the IV pole. You're not like doing any of the medical stuff. We're not starting IVs or anything like that. But you see like in that first picture, he's pushing the IV pole along with the patient in the bed. So the students learn how to arrange all of that so that they can safely transport the patient. The middle picture there, the technology they use for the transport job, so they have each transporter has an iPod, and then their computer system sends the job to that iPod, so they're able to start their job from that and know where they need to go, what their patient's name is, and everything like that. We also teach using the phone. So the students use and transporters use the hospital phones to contact the nurse to let them know that they're there to get their patient or that they're back with the patient, or sometimes they'll call other floors or other transporters. And then they also use a radio so that they can talk back and forth with other transporters. So we learned to use all of that. You'll see that last picture there, she's pushing a stretcher with an IV pole with a lot of equipment on there. So as we're teaching and training, we start with just empty equipment, and we'll push that around until the student's comfortable. We get IV poles so they can practice holding that and pushing the equipment with just one hand. So each week we build on the skills from the previous week. Transport is really fun. You definitely get a lot of walking in, and it's very physical, where sometimes you have to actually pull the patient over, and then also just interacting more as you're transporting that patient, talking to them. Fenway, anything else you want to add on this one?
So if you were on the video this morning, when I was talking about our lab area, so a lot of what is trained over the hospital is trained at the hospital, but we do have some setups here in our lab. And so one of them is the patient transport. So we have a hospital bed and a stretcher in our lab that we're able to practice on. So I know in the presentation this morning on our tour, I talked about making sure we don't want to drop patients over there at the hospital. So we practice it here in the lab.
We've actually used a sandbag before. Did you talk about that?
I didn't. I said that sometimes I've got on there some of other staff members so we can transfer and practice that.
Yeah.
So yeah, we want to make sure that it is a smooth transition over from the hospital bed to the stretcher, or from the hospital bed to wheelchair, because patients are being discharged and going home. So it's being very versatile in knowing the equipment that's needed and what to use and how to use it. Yeah.
Cool. Okay, so next up is inventory distribution. This is one of the 3 that we're actually training right now. So this one is a 10-week program, and distribution is a department that includes several different areas. So when the students are training, they learn to work in those different areas, and then during internship, they rotate around. Typically, the staff that are hired in work in one area, so they're assigned to a certain section of the hospital. But then there are some that are hired as floaters, so they know a lot of the jobs throughout distribution, and they're able to float around and do those different roles. So the first picture here on the left is the linen job. So the linen is actually sent off and washed somewhere else off-site, and then it's brought back. So it's already folded, but these big linen carts that get stocked throughout the hospital are stocked by the staff in the hospital. So during the week that we work on linen, they learn to stock these carts, and each shelf is labeled with what should go there, and then we just have to learn how to organize it onto each cart because they're all a little bit different. So it has like the gowns, bed sheets, towels, things like that that you would need up on the patient floors. The second job that we focus on is stocking supplies up on the patient floors. So the second picture here, they have this big blue cart that goes into a closet, that our third picture over where all those shelving, and then they take this cart out and stock all the server carts, and those are what goes into each room. So there's 5 drawers and they're all stocked the same way as you go throughout every single room there. Each drawer is set up a certain way. So the students learn by using a binder. It's got pictures of everything and then how many should go there. So they learn by using that and to stock the carts, and then they just work their way around the floor and gradually work on speed to where they can do that whole floor by themselves. Next up, you see the guy holding the scanner. So just like at a grocery store, the staff use that handheld scanner, and then there's barcodes on each item there in that closet. So they'll go through each day and scan anything that's low and enter that number into the scanner of however many's left, and then it will send that order, and then that gets filled for the next day. So this job is definitely a little bit of math, not a ton, but you want to have some basic addition, subtraction, multiplication, some division to be able to figure out, if you need a box, or if you need 100 and they come in boxes of 50, how many boxes you need to order. But the scanner then does the math of how many would actually need ordered. Oops. Okay. This last picture here, so we also teach the shipping and receiving end of distribution. So at the hospital, a ton of packages come in that are separate from the regular orders. So like special orders are sent through this receiving area, and then the person that works there opens the box and pulls out the packing slip, and then they just check each item and make sure that it's in the box. So then they check it off, initial it, and then send it off to be delivered throughout the hospital. So those are our main areas. We also learned to pick orders down in the warehouse, but it's transitioned to where most of the orders come from Plainfield now. So the staff in the warehouse are not having to pick as many orders. There are a couple of guys that pick orders that we have here and not at Plainfield. So we do practice that some, but it's not as big of a focus as it used to be. This one's pretty varied on if you like to have a lot of interaction with other people. So up on the patient floor, like the second picture there, you're going to be around the nurses, any staff that's coming and going, patients as they're out and about in the hallways. So there's going to be some more interaction there where the nurses might be asking you for a certain item that they know you have on your cart. So you want to be able to have some good, at least interaction, be able to answer questions, help people find stuff if you're up there on the floors. Down in the warehouse, it's more just your coworkers, and they usually have music playing. It's a more relaxed atmosphere, and it's fun down there, but less interaction with the public. Anything else on that one, Finway?
I don't have anything to add on that one. Nope.
Okay. All right, environmental services. So this is another one that we are currently teaching. So this one is very similar to housekeeping at the hotel, if you guys were on that one earlier, except that you are at the hospital and you're cleaning patient rooms. So with this one, we teach a little bit at a time, just like everything else. So we start off just the basics of how to stock your housekeeping cart every day, how to get your cleaning supplies ready, and then how to tear it down at the end of the day. And then we start with the side areas, so learning how to mop, how to wipe things down, how to get all the trash. And we use the side areas, or like the nurse's station or the supply rooms, but not in the patient rooms yet, because we want to learn those skills away from the patient just so we can talk through and practice and not be in the patient's room. Then once you've mastered that outside in the sides, we start working on what's called daily cleans. So you'll learn to clean the patient's room and just getting the main things while the patient's still there. They're not going home yet. So we go in and get the trash, clean the bathroom, mop the floors, and then wipe down the surfaces that are most commonly touched. And from there, you'll learn to do the dismissal cleans. And that's once that patient has left, then you'll fully clean the room and get it ready for another patient. So this one also has a good bit of interaction because you are going into the patient rooms, and sometimes there's family in there and stuff like that, that you'll be talking to them as you go in. Some students that we've had in the past don't talk much. They go in, they introduce themselves, they clean the room, and don't really say a whole lot aside from that, and that's fine. And then we have others that chat and talk with the patients and the family and have good conversations with the people. And that's just like any other staff there too. You'll have some that are really chatty and then others that are more quiet and just go in and do their job. Okay, our last one is nutrition services. And this one's a 10-week program also. This is kind of like distribution, where you've got quite a few different areas that you can be working in, and staff that work there rotate around throughout the day. So they're assigned to their role, and then they follow that schedule, and that includes rotating around to some different areas. So some are more focused in the dish room, and then others rotate around from the dish room out and about to get dirty trays and deliver food trucks and stuff like that. So the main thing we start with this one is in the dish room, learning how to unload dirty trays, because the hundreds of trays are brought down from each meal. So you can see the picture there with the trays on that rack. So they learn how to unload those onto like a conveyor belt, and then that gets run around and then loaded into the dish machine, which is the next spot that we learn, is how to load all of those dishes onto this big conveyor belt, and it goes through a dish machine. So they learn, like, you can see the hot plates there that the one girl's holding in the middle. We flip those over and load them in. So everything goes in a certain way. So we'll teach and practice that. And then on the flip side is unloading everything, and then just learning where everything goes once it's clean. The next main thing that we work on after that is the general cleaning, because after every meal, they're going to clean the dish room completely and get it ready for the next meal. So like you see in the picture there, we've got a guy mopping. They'll learn how to tear down the dish machine and clean out the inside, and then refill it, spray everything down, squeegee the floor, sweep up the trash, everything, and change out the trash bags also. One of the last things that we learn is the tray transport. So that is bringing down all of the dirty trays from all over the hospital. So you take a big cart out and go to it's called a soiled utility room. So you go to each one on all the patient floors and then load up those dirty trays and bring them down to the dish room. And then the person that's in the dish room will then wash them and run them through the dish machine. And then the flip side is delivering the trays. So the girl on the far left delivers up a food truck to a patient floor. So it's assigned to a certain area, and there's another staff member up there that she'll take that to, who then delivers the trays to the patients. And you see the guy on the computer there, that is the computer that they use to check out that cart. So there's a number on the cart, and then they know what zone it's going to, and they'll go to that computer there and click their cart number and check it out, so that the computer system knows that those trays are on their way up. Okay, and just like on our other ones, if you want any more information, if you go to egti.org and then click on our programs tab there, there'll be more videos and information about the hospital jobs. All right, I think it's question time, Finway.
Okay. So we had one question. I already addressed it in the chat, but I wanted to verbalize it as well, in case other people didn't see it in the chat and had the same question. Presentations from today will be on our YouTube channel later, hopefully tomorrow. I'm going to be uploading those tomorrow morning. So you will be able to access those then. I will be sending out an email just so everyone can access those playlists for those, so you can access those through our YouTube.
And I just thought of something else, the patient transport job. We do a CPR course through the YMCA here downtown. So if the student gets to do that course and does the hands-on course over there, then they leave with their CPR certification. CPR is not required at Ball for transporters, but it is required at some hospitals.
Correct. So some of the things we talked last time at our 3 o'clock with Zach about skill sets, skill levels, what you were learning in these positions could be very versatile and used in other positions. And so, yes, we're training in the hospital. That's the setting that Sarah is training our students in. However, a lot of these positions can be used in other facilities other than a hospital. So example, if a student is training in nutrition services, they are training in, they're training in the dish room, but that could also mean that they're going to go work in maybe a senior living facility, a cafeteria, a food court, anything like that. They could go work in those areas.
College setting. We've had some go to school, like high school lunchroom, things like that.
Yes.
Yes, definitely. So patient transport, I think, is the most focused in, where if you're going through the patient transport program, there's not as many other options that are similar to that. The closest ones I've found are the guest relations job at the front of the hospital, because you're sometimes transporting visitors up to patient rooms, or people coming in for tests, you'll take them in their wheelchair to that. Or in an airport, they actually have people that are hired to transport, what would you call them?
Like TSA.
Travelers to their, like, to the gates, and they use a very similar system, like with an iPad that tells them what person they're getting and where they're taking them to. So that would be fairly similar, but you don't have to worry about the medical equipment. And distribution, I mean, any, like Amazon, FedEx, any place that has some sort of distribution warehouse would be very similar skills. I just saw Fenway, somebody was asking about COVID here. So we are fully training. We are allowed in the hospital with our students. We're running just like we would before COVID with our training programs. So the students are allowed in, their training, they're doing their internship. We are not allowed to do career sampling in the hospital right now.
And the difference between our career sampling sessions and our career sampling session and our regular training, and how we are allowed into the hospital right now with our regular training and not career sampling, is because our students, the staff, Sarah, myself, Megan, Daniel, when we're over at the hospital, we've gone through all the background checks. We have gone through all of the medical necessary
immunizations, vaccinations, forms, drug screens, everything.
So the hospital has all of our information for that, to where we have been cleared to be in the hospital, to where for our career sampling session, that is typically a 2-day, and we are just having the students register, and we don't get that documentation from the students. So we're not able to be over there. Just like the hospital has their regulations right now, their restrictions of internships aren't allowed to be over there, or their volunteers in the hospital, things like that. They've limited
the volunteers, yeah. Internships, student internships are allowed, but the typical hospital volunteer, they've restricted down where there's not as many people in the hospital right now. But Erskine Green students are there, nursing students are there, so good to be fully functioning back in.
And so that's where we have a lot of people that are really interested in our healthcare program and want to be training over in that setting. And we know that. And so we're have been throwing out ideas of, since we can't be over there to see those jobs, how can we bring it to you to show you what those jobs entail, to give you a full idea, even more so than a presentation like this, to kind of give you some hands-on experience through virtual experience. So we are putting our heads together, working on that, trying to figure out what that's going to look like. And so we've got some plans coming up in the next several weeks where we will be doing some potential presentations with going more in depth of what our programs in the healthcare programs look like.
I love it over there.
Me too. I miss it. Are there any other questions? That was a great question about the COVID restrictions. Another thing that we are doing COVID related, I don't know if it was talked about earlier today, but students, our students currently here, they are wearing masks in public places. When they go out to eat, they're wearing masks. They all have their single rooms right now, and so those have been covered. We also are doing temperature checks every morning, and so we have that. We are charting those. Over at the hospital, those students that are training at the hospital, they're wearing a mask when they get on the bus to get over there, and then they have to get a new mask when they walk in the hospital. So that is one of the requirements for the hospital setting, is that you get a clean new mask when you walk in. And so that is the precaution that they are taking over there, and so that's great. Another question is, has Ball Memorial hired any students directly from your training program since you are seeing the particular students in training? Yeah, so we have, I talked a little bit, I'm gonna let Sarah jump in a minute, but we've networked with IU Health throughout the whole system of Indiana. And so when a student is graduating from our program and they are looking at applying to an IU Health facility, we want to know that so that we can reach out to the HR department. And so Sarah has built a great relationship with the HR department here at IU Health Ball Memorial. So I'm going to let her talk about what that kind of looks like and the process that she goes through when she has a student that is applying at IU Health.
Yes. So when someone applies to IU Health, we tell them before they graduate, and it's on some of the paperwork they get, to reach out and contact me. So if they've applied anywhere, IU Health in the state, they'll reach out, tell me, and then I reach out to an HR contact here in Muncie, and then she contacts the hiring manager of that hospital. And it's basically just saying, hey, this person's applied, they went to Erskine Green, and they went through this training. And it doesn't guarantee that they'll get an interview, but it gives them a better chance of getting pulled out, called in for an interview, and then hopefully hired. Fenway, do you know the numbers on how many have been hired through IU Health? I feel like it's somewhere around 8 actually at Ball, and then quite a few. I think we got an email the other day. Were you on that?
Let me look at it real quick.
Yeah. So definitely, I think at Ball, it's beneficial that the supervisors get to see that student while they're training, and then also in their internship. And we've partnered with the managers and like with patient transport towards the end of the internship. The supervisor will go around with that student and assess them just like they would one of their staff. And then if they feel comfortable, then that student actually gets to go out on their own as a transporter the last couple weeks of their internship. So they're working just like any other staff would be working. So it's very helpful for the supervisors to see that and see their work ethic and their skills, and then know if it's someone that they want to hire.
Yeah, so I just pulled up the email. So all across IU Health networks throughout the whole state of Indiana, we have 18 students that are working in the IU Health network. So we have 1, 2, 3, 4, 5, 6, 8 that have been hired at Ball Memorial Hospital once they graduated. Yeah, so another question, I hope that answered your question. So does IU have standardized procedures with supply stocking and transportation? They do. They've got their standard protocols and everything. So Sarah knows all of that. So I'm going to switch that back over to you.
Yeah. So, okay. So like the iPod for transporters, they use that. And then they use a system called teletracking. So then that's what sends out the jobs onto that iPod there. And I believe all IU Health now uses that. They've when we first started, they were not using iPods. They were still using pagers, and they've transitioned to the iPods just in the last year and a half, 2 years or so. So I think all the others were transitioning about the same time. Inventory distribution. So the IU Health recently, in the last couple years, started a warehouse in Plainfield. So that is like their central distribution for supplies. So when we order supplies on one of our patient floors with that scanner, it's actually sending that order to Plainfield, and the orders are picked there and then sent over on a semi in a bunch of totes that are labeled, and then those get delivered throughout the hospital that then the staff put away. So that would be very similar at other hospitals too, where it's coming from Plainfield and then gets put away. Now each hospital is going to be slightly different, but they all will be using the same sort of system.
Yeah, because Sarah and I visited, gosh, that was probably like 2.5, 3 years ago. We went down to IU Health North there in Carmel, and they were using a different stocking system in the sense of they were using like pods. So it was a secure system that you had to punch in and like type in a code to get things unlocked. And so that was their tracking system. So every hospital, even in network, is going to have a little bit things differently. But for the most part, they're going to be the same.
I just saw they said that they've had a client try to get into IU Health Tipton for 2 years. I don't know the whole situation, but some departments are harder to get into, and depending on the job, it's posted internally first. So with that client, if they would have any interest in applying to a different department within the hospital, once you've worked there, the guideline at Ball, and I believe IU Health, is once you've worked there 6 months, you can then look at transferring around to a different department. So inventory distribution seems to be one that's been a little bit tougher to get into just because there wasn't as much turnover at Ball, but there has been recently. But anyways, that's one that's been a little harder. But then if you're in the hospital already, like say you're working in patient transport and a job opens up in distribution, then you would see that posted before the public would see it.
Yeah, and with one thing to keep in mind that when I'm talking with family members and students that are looking at our program, if you're looking at a hospital setting and you're looking at our program, go and look at that hospital. If you were planning on returning to your hometown to work at that hospital, make sure that they have that program, they have that department. Because I know where I'm originally from, up north of Indiana, northern Indiana, that my rural hospital in my hometown does not have patient transporters. So if a student is from that county or from that area, in the rural areas, they might not have those positions. So being
patient transport would be the most common one that they would not have.
Yeah.
Distribution would be another possibility. If it's small enough, they may have the techs or other people also stocking the supplies. But yeah, those would be the two main ones.
And you were right, Sarah. The turnover can sometimes happen a lot, and sometimes it's not. And so in a rural setting, if a person has been in that hospital for a while, in that position, maybe 20 plus years, they might not have open positions, unfortunately, when we want them. And so I like your suggestion that you said, is there a possibility of getting into another department and then transferring internally once in the network is always good.
Yeah.
Great questions. Are there any other questions? We have a couple minutes left here. If you think of any after we close out this meeting, go ahead and just email us at info@egti.org, and we will get those answered and back to you. We also, like I said, we will put these recordings on our YouTube channel so that you, or maybe some clients, or maybe you're working with some family members that are curious about EGTI and they haven't heard about it, this is a great opportunity to learn more about our programming. And getting to hear it from the instructors is great because they are in each setting day to day. So if there are no other questions, we are going to sign off here. And if you have any questions, send us an email or send us a message on Facebook, and we are looking forward to hearing from you. Have a good evening. Enjoy the nice weather. It's super nice here in
Thanks,
Muncie,
guys.
so hopefully it's nice where you are.